My name is Dr. Eric Moore. I'm a head and neck surgeon here at the Mayo Clinic, and I'm pleased to introduce today Heidi, who is a patient of mine who was diagnosed with a parotid gland tumor and had a superficial parotidectomy here. Heidi has graciously agreed to participate in this video Q&A project to help assist viewers in making personal decisions with their own parotidectomy journey. This mission is to help patients by answering questions in advance or in the midst of your parotid research, diagnosis, preparation for surgery, and recovery. For those looking for a detailed Q&A, please reference our completed Facebook Live event that is housed on the Mayo Clinic Otolaryngology Head and Neck Surgery Facebook page, or simply search Mayo Clinic's YouTube channel for our video Q&A about parotid tumors. Heidi, thank you very much for joining us. This is a real pleasure for us. What kinds of questions should we discuss this morning?
Good morning, Dr. Moore. First of all, I wanted to talk about preparing for a visit to an ENT because for many of us, myself included, this was the first time that I ever saw an ENT. So although I had done a lot of research prior to coming to see you, I really didn't know what was going to happen when I came in for that first appointment. So could you talk a little bit about what is going to happen when you first meet someone who has discovered a lump in their parotid gland?
Sure. So many patients come in having discovered the lump themselves and might have had some type of workup previously from a visit to a physician, may have even had some diagnostic workup performed such as a biopsy or imaging, and then other patients just noticed a lump and came in. So we see patients with all those different kinds of backgrounds. Typically, if anything was done previously, like a biopsy or any type of imaging, it's very helpful for me as a physician to see that information. Not just the reports of what someone thought about the information, but to actually see the scans, see the biopsy results. But it's not essential that people come in with that. As a first step, when we meet the patient, we try to get some information about how long they've had that mass, how did they discover it, what types of symptoms did they have that went along with that mass, because that's very helpful for us in trying to develop a story. A differential diagnosis is a story about this tumor and how it's behaving. Is it growing quickly? Is it growing slowly? Has it been present for months? Did they just notice it yesterday? And what types of things it's causing them to feel is very important for us to determine. Is this something we're very concerned about? Is this a malignant cancer? Is this a benign tumor? Is this something that's just normal part of the parotid gland?
Okay, so in addition to kind of covering that material with the patients and answering whatever questions that they might have, is there like a physical exam that's involved that someone can expect to have happen when they come in to see someone like you?
Absolutely. That's the next important step. So after we've garnered that information and found out something about that mass, the next thing we want to do is a physical exam. And the most important things in the physical exam that we think are, how does the lump feel? Is it something that we can also feel, or just something that the patient can feel, meaning it might be more deep-seated and I might not be able to feel the lump in their parotid gland, or is it something that I can put my hands on and feel it? The next most important thing is, does it move around? So that mobility is so crucial because it's telling us, is this mass stuck to something? And most of the things around the parotid gland that it could be stuck to are critical. Is it stuck to bone? Is it stuck to the nerve that comes out of that bone that moves the muscles to the face? Is it stuck to the jawbone? Is it stuck to blood vessels? Or can we wiggle it around very, very easily? So the physical examination is always going to be done. It's going to require laying hands on that mass in the patient and feeling the tumor, and is as important as the first part of the history.
Is there anything that you feel like patients can do before coming to see you to prepare for that visit and then to make sure that they get the most out of the time that they get to spend with you during that consultation?
Yeah, great question. So I think doing a little bit of reading and a little bit of research is helpful because it helps people understand the vocabulary. Sometimes physicians aren't great at understanding that people aren't using the same words day to day that they're using. And so doing a little bit of research and finding out some of the terms, and then maybe being prepared to ask their physician, what does this mean? What does it mean when you say this? What does it mean when you say that? As long as I've been doing this, I still sometimes forget, oh, they're not going to know what I'm talking about when I say lesion, tumor, parotidectomy. And so having some working knowledge of those terms and being able to ask the physician what those things mean can be very, I think, helpful for the patient. Organizing anything that's been done. So there's a limited amount of time to spend, and we want to maximize that time. And so getting some organized thought about how long has this been there? What did I first recognize? How has it progressed? How has it changed? Getting their records together and bringing them with them just helps keep the process from becoming derailed because we don't have some important piece of information that might be useful that we have to wait for.
Okay, thank you. So I think when I came to see you and when I left there, I definitely had all my questions answered. I knew what the surgical plan was. I knew what the treatment options were, and whether or not I was going to do reconstruction and the pros and cons of those things. So is that something that you feel like patients should have all of that information when they leave that initial consultation? And if for some reason it's not covered by a physician, that they should ask those questions?
Well, Heidi, if every patient came as prepared as you did with their questions, my job would be a lot easier, and that you're certainly not the expectation that I have for people. But yes, making sure that the questions that you have are written down, I think, is helpful because things get going, you start hearing a lot of information, it can become overwhelming. Making sure that we didn't skip over some important question that you really need to know before you leave. I try as a physician to anticipate questions and tell people the things that I would want to know, but I could be very off base and I could miss a question that's extremely important to you. So having those questions written down in an organized fashion and making sure that those questions get answered before you leave, I think is very important.
And I think a lot of people feel like if those questions aren't answered, for some reason they forgot something during the initial consultation, that's it. Like they can't go back and ask follow-up questions. Clearly, I did that. I asked you follow-up questions. And is it okay if patients do that so that they can have all their questions answered as they're making decisions about their own care?
I think that's a great question. And I think you're right. I think people think, well, he didn't tell me this. It must not be important. Or sometimes they feel like, I don't want to bother that person by asking this question. For me, as much of the information that we can get out there and sort of clear the air before we ever get started, the better off we are in having a successful outcome. So I always encourage people, did I get your questions answered? Is there something else you have? And I anticipate that maybe they might have forgotten something. Like I said, it's an emotionally laden visit. There's a lot of things to cover, and it's okay to say, oh my gosh, I forgot to ask this person this, and contact that physician. And I would say, if you contact that physician and you say, I have another question, and they don't get back to you or are willing to answer that question, then I might seek another physician, because if you're not getting the questions answered before you started, it's probably not likely you're going to get the questions answered after something comes up.
Great, thank you.